This presentation and the following two are going to talk about allied health assistants as a workforce and then unpack some of the principles of successful workforce redesign when implementing an allied health assistant into your setting. The learning outcomes, in particular for this presentation, are understanding the allied health assistant workforce. So what do we actually know about the allied health assistant workforce? Well, the first thing that you need to understand, and we all know, is that there is no formal registration or regulation of the assistant workforce. This tends to be at a setting by setting level. So this in itself enables great flexibility of the role and scope of practice, which enables allied health assistants to fill gaps in service provision in many ways. However, the flip side is that it means there's limited data on this workforce because there's no one place where this data is collected. So here are a few bits and pieces that we do know about the allied health assistant workforce. And the key things to think about is that it's a growing workforce, that mostly it's female. The median age is around 47, and a lot of assistants are currently working in aged care and in multidisciplinary streams of clinical provision. Most have a Cert 4, and about a third of the workforce works in rural and regional areas of Australia. This quote is taken from one of the references that's in the end of this presentation from a chap called Mike Sachs, who's been watching the support workforce for a very long time. He states that the healthcare support workers are the largest part of the healthcare workforce on the ground. The other thing that we know about allied health assistants, and again this is also in Professor Nancarrow's new book and Mike Sachs's book, he talks about the fact that support workers are differentiated from professions because they do not have ownership over a unique body of knowledge. Perhaps reflect on how this looks for you with your professional hat on. And what ownership do you have of the knowledge that you might be imparting to assistants in your business? Allied health assistants were documented as early as the 1950s in OT in Canada and then followed closely by podiatry and physiotherapy assistants in the NHS in England. There are numerous titles that are used to describe the assistant workforce, and here are just some that we've found in our travels along the way. As you can see, there's a number of references down here. These ones are the ones that apply mostly to the Australian private sector. We're talking about all these different names, and you can see then why it's very hard to collect data around this workforce when very few use the same name. So what do allied health assistants do? So allied health assistants are tasked with the role of freeing up allied health professional time. They support and assist the work of allied health professionals, often by undertaking a range of less complex tasks that are delegated to them by the allied health professional workforce. So whilst most AHAs have some vocational training, i.e. the Certificate 4, the roles themselves are largely defined by the context, the practitioners and the patients that they are designated to support, or the clients, that is, in some of your private settings. This is just a small gathering of some of the domains or roles that have been identified within the evidence base. Assistants deliver direct care roles and indirect care roles. And again, this kind of information has been researched for a while now, but it shows you the extent of variation in the types of roles that support workers and assistants undertake. It's important to understand that whilst you have a vision for what your AHA role might look like, these things influence how that role looks in practice. We know from the evidence that allied health roles are influenced by the setting in which the role is performed, the type of patients assigned to the assistant, the number and type of practitioners with whom the assistant works, the way that delegation is practiced in the organisation or the service or the team, and the extent to which professionally qualified staff have control over the access and content of training of the assistants. Familiarise yourself with these points, as they are the points that are going to influence exactly how your AHA will function within your service. Here is a list of some of the key issues that face the current allied health assistant workforce. We know that allied health assistants have limited career opportunities, and this is no surprise given our previous slide that looked at all the different things that influence the type of roles that allied health assistants carry out. This is also influenced by the fact that allied health professionals themselves, and reflect on your setting and your team, that allied health professionals themselves have limited career opportunities. And so with limited career opportunities for those who are delegating tasks to the assistant workforce, there's no room for growth for either the allied health assistant or the allied health practitioner themselves. Another key issue for the assistant workforce is they have limited access to professional development that's specifically developed for allied health assistants. Often they're poorly remunerated and underutilised. This is a core problem that faces the allied health assistant workforce, and it contributes to lack of satisfaction with the role and also eventually turnover of that position. But underutilisation of the assistant workforce also undermines the impact or the efficiency and effectiveness that that role can provide to your service and your business. Allied health assistants are also privy to ad hoc supervision and support structures. And again, on the next slide, we talk about the way that impacts the assistant workforce. And finally, we see that allied health assistants tend to have extreme variation in roles and skills, which precludes their ability to transfer their roles to other settings. So reflect on when you may have worked with an allied health assistant and consider where they came from. Have they always been with your organisation or the team that you were with, or had they come from somewhere else? What kind of extra training did they need to do in order to be able to transfer their role to your setting? This is a big problem for allied health assistants, but it also has a flip side. The fact that an allied health assistant role is determined by the setting that they're in allows them to train in areas that you need them to fill. The impact of these issues is that allied health assistants tend to have a high intention to leave the role and the workplace. There can be poor efficiency with the role and unrealised potential, and we know that these are true impacts. We have some references here to support this. And these are common themes throughout all the assistant literature. The final point for this presentation is that given the large investment of time to train and supervise allied health assistants, it is imperative that the role is sustainable and reproducible. And that is one of the key impacts that we need to consider when developing our allied health assistant role. Here's some references for you to read through in your spare time.